Have you ever felt dizzy? Have you ever had your world spin around you? We've all been there, that sudden feeling of imbalance. The room spinning around us, the ground seemingly shifting beneath our feet. It's unsettling, it's alarming, and yet it's a sensation we've all experienced. But what exactly is this dizzy feeling? Why does it occur? Today we'll be exploring these questions and more, demystifying this all too common yet often misunderstood sensation. Stay tuned as we delve into the mystery behind dizziness. Now, before we unravel the causes, we first need to understand what dizziness is. Dizziness is a term we've all used at one point or another, but what does it really mean? In the simplest terms, dizziness is a sensation of unsteadiness. It's a feeling of being off balance, like you're swaying or tilting when you're not. It's a perception of motion, often described as spinning, even when you're perfectly still. But here's where it gets a bit tricky. Dizziness is a broad term that can encompass several different sensations. For instance, there's vertigo, which is a type of dizziness that creates the illusion of the world spinning around you. It's as if you're on a never-ending carousel ride. Then there's faintness, which is a feeling of being about to pass out or lose consciousness. It's like the lights are dimming, and you're not in control of the switch. Interestingly, while these sensations can be quite disconcerting, they are not always indicative of a serious health issue. Sometimes they might just be your body's way of signaling that something is off balance. It's also important to note that dizziness can be a symptom of a wide range of conditions, from benign ones like dehydration to more serious ones like heart disease. But we'll delve into that later. So now that we know what dizziness is, let's explore why it happens. Dizziness isn't just a random occurrence. It's often a symptom, a sign that something else is going on in our bodies. Let's delve into some of the common causes that might make your world spin. First up, dehydration. It's no secret that our bodies are largely made up of water. When we don't replenish our bodies with enough fluids, it can result in imbalances, leading to feelings of lightheadedness or dizziness. So remember, staying hydrated is not just about quenching thirst. It's about keeping balance in our bodies. Next, low blood sugar. This is a common cause of dizziness, especially for those managing diabetes. When the sugar level in our blood drops, our brain doesn't receive enough energy to function properly, which can lead to feeling faint or dizzy. A quick snack can often help to alleviate these symptoms. Another factor to consider is changes in blood pressure. A sudden drop can cause a brief dizzy spell known as orthostatic hypotension. This is particularly common when standing up too quickly. On the flip side, high blood pressure can also cause dizziness, although this is less common. Let's not forget about medications. Certain drugs, including those for hypertension or seizures, and even some types of antibiotics, can have dizziness as a side effect. If you've recently started a new medication and are experiencing dizziness, it might be worth a chat with your doctor or pharmacist. Lastly, motion sickness. It's not just a problem for sailors or roller coaster enthusiasts. Any form of travel can cause your brain to receive conflicting information about motion and your body's position, leading to dizziness. These are common culprits, but sometimes dizziness might be a sign of something more serious. It's always important to listen to your body. If your dizziness is persistent or accompanied by other symptoms, it's best to seek medical advice. After all, it's better to be safe than sorry. While often harmless, dizziness can sometimes be a warning sign. In some cases, it can be an early indicator of more serious medical conditions. Let's delve into some. One potential cause of dizziness is a stroke. This is a medical emergency where blood supply to part of the brain is cut off, which can cause a sudden severe headache, confusion, trouble seeing, and of course, dizziness. If you or someone else experiences these symptoms, it's crucial to seek immediate medical attention. Another condition that can cause dizziness is multiple sclerosis, often referred to as MS. This is a chronic disease that affects the central nervous system, which includes the brain and spinal cord. MS can cause a wide range of symptoms, including dizziness, fatigue, difficulty walking, and problems with coordination and balance. If you're experiencing dizziness along with these other symptoms, it's a good idea to consult with a healthcare professional. Then there's Meniere's disease. This is an inner ear disorder that can cause episodes of vertigo, a spinning sensation that makes you feel as if you're moving when you're not. It can also cause tinnitus, which is a ringing in the ears and hearing loss. And let's not forget about migraines. These severe headaches can cause a variety of symptoms, including dizziness, nausea, and sensitivity to light and sound. Some people may even experience a type of migraine called a vestibular migraine, which primarily affects their balance and can cause severe dizziness. It's important to remember that while these conditions are serious, they're also relatively rare. Most instances of dizziness are caused by something much less severe. However, if your dizziness is persistent, or if it's accompanied by other worrying symptoms such as chest pain, shortness of breath, or a severe headache, you should definitely seek medical help immediately. Dizziness can be more than just an inconvenience. It can be a sign that something is going on in your body that needs attention. So if you're feeling dizzy, don't ignore it. It's always important to listen to our bodies and seek help when needed. So we know what dizziness is and why it happens, but what can we do when it hits? Dizziness can be an unsettling experience. That sudden feeling of being unsteady or having a sensation of spinning. But when it strikes, there are several practical steps you can take to help manage the situation. Firstly, sit or lie down. This might seem obvious, but it's a critical first step. When you're dizzy, your sense of balance is off, and standing can increase your risk of falling. So, find a safe spot and sit or lie down until the feeling passes. Staying hydrated is another essential factor. Dehydration can often be a culprit behind dizziness. So, make sure you're drinking enough fluids throughout the day, especially if you're in a hot environment or doing strenuous exercise. But remember, this doesn't mean chugging a gallon of water all at once. Aim for a steady intake of fluids throughout the day. Avoiding sudden changes in position can also help. This is particularly true if you're dealing with orthostatic hypotension, a drop in blood pressure that happens when you stand up too quickly. Try to make a habit of moving slowly, especially when getting up from a sitting or lying position. Another helpful tip is to focus on a fixed point. When you're dizzy, your surroundings may seem to spin or move. Focusing on something that isn't moving can help your brain recalibrate your sense of balance. Now, these are just some strategies to help manage bouts of dizziness. They can be useful in the moment, but they're not long-term solutions. If you're frequently feeling dizzy, it's vital to get to the root of the problem. And that brings us to the most crucial point. If you're experiencing persistent or severe dizziness, it's essential to consult a healthcare professional. They can help identify the underlying cause and develop a treatment plan tailored to your needs. Remember, these are just quick fixes. For persistent dizziness, it's crucial to consult a healthcare professional. Dizziness, while often harmless, can be a sign of a variety of conditions. This statement underscores the importance of the discussion we've had in this video. As we've explored, dizziness is a sensation that many of us have experienced at one time or another. But it's not something to be dismissed casually. It's a signal from our bodies, a message that something might be amiss. We delved into what dizziness is, a subjective feeling of unsteadiness or a sense of the world spinning around you. We discovered that it's not a disease but a symptom, a sign pointing to an underlying issue. We learned that it could be as harmless as standing up too quickly or as serious as a heart condition. We unpacked some of the common causes of dizziness, like dehydration, low blood sugar, or inner ear problems. We also looked at how certain medications can make us feel dizzy. These are instances where the dizziness is usually temporary and can be managed with simple lifestyle adjustments or a chat with your doctor about your medication. But we also discussed the serious causes of dizziness, like cardiovascular issues, stroke, or multiple sclerosis. These are situations where dizziness serves as a warning bell, an urgent call to seek medical help. And finally, we talked about dealing with dizziness. We discussed how to recognize the signs, what to do when you feel dizzy, and when it's time to seek medical help. We stressed the importance of understanding your body, of being in tune with what it's telling you, and of not ignoring the signals it sends. Dizziness is more than just a fleeting feeling. It's a symptom, a signal, a sign. And understanding that sign, decoding what it means, can be vital to maintaining our health and well-being. So, let's not ignore dizziness. Let's not dismiss it. Let's understand it, respect it, and respond to it. So next time you feel dizzy, remember it's not just your world spinning, it's your body trying to tell you something.